others, both by individuals, governments at different levels, and all these concerted efforts would help to save lives of our citizens. The Trauma Care International Foundation, since its inception, has executed over 10,000 safety and emergency response projects directed towards various organizations, communities, such as school children, teenagers, the Trauma Care International Foundation of the Trauma Care International Foundation. I know that we have a lot of guests that are seated here. I didn't want to be calling names of maybe those who have not been seated, but distinguished guests, let me quickly, before I call on the chairman, the esteemed CEO and chairperson of TCIF, represented by the esteemed Pastor Dr. Emeka Eze, I'd like to recognize some very distinguished guests that are seated with us here today. We have the representative of the Honorable Commissioner of Health, Lagos State, ably represented by Dr. Adeolu Arogudade. Please, a round of applause for him. I also want us to recognize Dr. Olusegun Ogboye, who is also able to. Please, if you are representing the PAMSEC of the Ministry of Health, please let us know, and then we can also let everybody here know that you're here. Dr. O.A. Kola Korolo, Director of Lasambos. Thank you very much, sir, for your presence. Dr. B.I. Oshikomaya is present here. Please put your hands together for them. These are distinguished persons who have committed to being here. And Mr. Olusegun Ogungbemide of the Lagos Sector Commander of the FRSC, ably represented, I think. Please put your hands together. Thank you. Ably represented by Mrs. Fekoya. Thank you. Please put your hands together for her again. I also want to recognize, if present, the National Coordinator of the Scouts Association of Nigeria, Engineer Oyetayo Babatunde. Okay. Dr. Banke Odunsi, an Assistant Director and the Head of Lagos State E-Health Unit. Please put your hands together as we call their names. And I'd like us to recognize here Mr. Femi Da Silva, if present. Please put your hands together for him. Please also join me in recognizing Pastor Dr. Emeka Eze, the representative of the chairman, Trauma Care International Foundation. Please put your hands together for him. And all other distinguished gentlemen of the press who are here, ladies and gentlemen, permit me at this point to invite for his remarks the representative of the chairperson of Trauma Care International Foundation, Pastor Dr. Emeka Eze.
Good morning, distinguished guests, ladies and gentlemen. I want to once again welcome you to this very auspicious occasion, the launch of the TCERA app suite to help us achieve our collective healthcare goals. Once again, I welcome you to the TCERA app launch. God bless the Federal Republic of Nigeria, and God bless Africa. Thank you so much.
Trauma Care International Foundation was established on the 5th of January 2012 as a registered non-governmental organization with the vision to improve the state of trauma care and emergency response services in Nigeria and its member nations through health education. With the vision to improve the state of trauma care and emergency response services in Nigeria and its member nations through health education, advocacy, and community-based programs. TCIF is a Guinness World Record holder and a non-governmental organization in special consultative status with the United Nations Economic and Social Council since 2019. With trauma listed as one of the leading causes of death globally and contributing extensively to the thousands of deaths recorded every year in Nigeria, Trauma Care International Foundation, in line with its objectives to significantly reduce the delay in patient evacuation and the institution of pre-hospital care of trauma cases, launched its Emergency Response Initiative in 2020 to further address this through community-level incorporation in the provision of prompt and effective emergency care.
My name is Oyedepo Miriam Nneka. I'm a resident of Lagos State in Nigeria. I'm so excited to be part of this training today because beyond just adding of knowledge, I've come to realize that it's a responsibility for every citizen to be conscious of being safety and saving lives around the environment. For me to go through and much more, very importantly, be certified so I can put to work every training to save lives in my environment, to respond immediately in case of any emergency around me, not just to walk away or to shout like every other ignorant citizen, but now I know my role in the society, in nation building, and at large for every one of us to stay safe and also to build a better nation.
The foundation designed and launched a network of individuals from every walk of life, trained to provide emergency medical first response to victims of trauma before the arrival of the emergency medical services. This network is known as the TCIF First Responder Network.
I am Engineer Babatunde Oyetayo. I'm an aeronautical engineer, and also I'm the National Executive Commissioner for the Scout Association of Nigeria. In Trauma Care International Foundation, I haven't come up with this initiative. I believe that there's a lot they are going to do to save lives in Nigeria, and they have started. For us in the Scout Association Nigeria, talking as a national officer, this is a grand opportunity for us to partner effectively with Trauma Care Foundation International. And I, as the National Executive Commissioner, I'm going to raise the stake to be able to partner effectively. We're going to put up our letter of partnership to the foundation so that we can reach more people.
The pilot phase of this project kicked off in the city of Lagos in 2020, and thus far we have recruited over 3,000 volunteers from the 20 local governments across the state. We have trained and equipped over 25% of them with first responder kits, and the training sessions are still ongoing.
In case you witness a road traffic crash, the person is unconscious and is not breathing, please just do what we're about to do.
We have received several testimonials from our first responders and its potential impact on pre-hospital care. The Foundation developed an emergency response application, the TCERA app suite, to connect victims of trauma with TCIF-trained first responders in the shortest possible time. This application provides users with a real-time response from specially trained first responders, as well as vital information.
That may not have been accomplished. There have been distractions. We saw that as much as 5.8 million people die annually from injuries. 1.3 million people die annually from road traffic crashes. We see that 20 to 50 million people are injured without dying from road traffic crashes every year. And that has a lot of implication. Because we know that more than 70% of people that are involved in road traffic crashes are men within their reproductive age group. We also know that these 20 to 30 million people that are involved in road traffic crashes are also may become the source of poverty for the family. When a young man is involved in his reproductive age group, is involved in a road traffic crash, he first of all arrives at a hospital, if he does not die, where a lot of resources will be needed to even get him into the hospital and secure him care. So if there's any saving in the family, it is first of all wiped out. And the young man in the family is also probably a productive member of the family.
for the victims. We have a number of partnerships we've engaged over the last 5-10 years. To it home, about around 2012, when Trauma Care International Foundation came on board, it was thought out that Las Ambos there should be a turnaround for Las Ambos, and a lot of things were looked at. I remember Shell Nigeria Exploration Production Company was brought on board to look at some of our processes and improve our documentation, and also TCIF came on board. We have partnership with a non-governmental organization in Texas. We have one with a Canadian organization. So about 6 of them are existing. And the government has also improved, increased the human resource funding.
First and foremost, ensuring we have people interested in attending to emergencies rather than be bystanders, being able to effectively, administrate the right first aid skill in any emergency situation. And that is the root of the first responder network. We thought that the state government has been doing a lot, but when you think about the population of Lagos, you know that there is a lot to be done. And we have 57 local council development area in Lagos. And what we are doing in our first responder network is to ensure we have a good number of people in each of these LCDAs, so that it could happen in the market. It could be a school that an emergency will occur. Someone somewhere that is a TCI first responder trained individual, that is a trained volunteer, will be able to do it. And in a way, the partnership is such as taking advantage of the goodwill of Lagosians. Hardly will you find someone in Lagos that is not willing to help. But sometimes the issue is they don't know how to go about the help. So what the NGO is doing is reaching the everyday people with the right training on what they should do or what they can do when an emergency occurs. And that way, the time lapse between getting help is shortened, and it makes survival better. Right. Now, we're going to go to the next person, in the person of esteemed Dr. Adeolu Orogundade. The question is, in a world that is fast evolving technologically, what is the role of the technology? What is the role of technology in the delivery of pre-hospital care? And in what ways can we make it better, considering the current milestones Lagos State have achieved so far?
Okay, thank you very much for that question. I believe strongly that technology has a significant role in addressing pre-hospital care all over the world, not just Nigeria. And there's a lot of examples to learn from. I was in Luxembourg or thereabout, somewhere in Europe, some time ago, as far back as about 10 years ago. And I became aware of this using wearable technology. An organization we're trying to work with had this technology that they got a bracelet for elderly women who live alone in their homes. They wear the bracelets, and the bracelets has gyroscopes, accelerometers, all of those technology embedded into it. So if the woman was to take a fall in her house on her way to the bathroom,